I'm Dr. Salman Naqvi. I'm a pulmonologist. I'm here on behalf of Shine Humanity, which is a non-profit medical organization. I'm sure you've heard a lot about prevention, which is essential. Without prevention, we are all in trouble. But let's assume that you have the infection, you got the virus. What to do? If you are concerned that you will be hospitalized if you need it, not really. Most of the people will remain asymptomatic. That is, you will not even know that you have the infection. But that is a problem because you are a carrier and you can give the infection or transfer the virus to others. But if you are infected, you may start to have the symptoms from day number 2 to day number 14 of the viral infection. Most of the people will get infection from day number 5 to day number 8. The symptoms include gradual onset of fever, which can become high as the time goes. Now, the other symptoms are dry cough, not a productive cough, but a dry cough, headaches, fatigue. Few of you may get nausea, vomiting, or diarrhea. These symptoms over time will resolve on their own. Since there's no treatment for coronavirus, the treatment is just symptomatic. That is a lot of rest, plenty of fluids, and paracetamol for fevers. Do not use Advil, Motrin, ibuprofen, as the data shows that they may accelerate the viral replication and the disease process. Majority, and again say majority, will improve spontaneously. It's a very small number of patients whose symptoms will progress. The sign of progression is shortness of breath, and the shortness of breath that persists, not the one that is transient, comes and goes away when you're feeling calm and quiet, because a lot of people may get shortness of breath or sensation of shortness of breath due to anxiety. So, if the sensation of being short of breath is persistent and getting worse as the time goes, then it's a little concerning. Now, very few of these patients may start to feel dizzy, have discoloration of their lips or fingers, then it's concerning. If that happens, then you need to get medical help immediately. Same for little children, fever, dry cough, fatigue. For infants, it will include rapid heartbeat. Now, there are a lot of you who may be suffering from asthma, COPD, or allergies, especially these days. If you have typical symptoms of asthma like cough, chest tightness, wheezing, and if you have history of asthma, treat your asthma as you regularly do with inhalers, inhaled steroids, oral steroids, and other medications that you use. Just remember, try not to use nebulizer when you're around others, because nebulizer can aerosolize the virus, which can suspend in the air and can infect others. Use a regular inhaler for shortness of breath. If you have symptoms of runny nose, sneezing, itchy eyes, scratchy throat, and you have known history of allergies, then you probably have allergies. Treat your allergies the way you regularly do. There are a lot of questions regarding use of oxygen. Oxygen is usually not required and will not help you if you're not feeling short of breath, if you're not dizzy, if you do not have bluish discoloration of your lips or extremities. It's, again, very, very few people who will get that. And if you reach to that point, you need to be in the hospital, you need to seek medical help. So don't try to get oxygen at home, because it will be needed in the hospital. Same is the case with medication called hydroxychloroquine, which is an anti-malarial medication with combination of azithromycin. There's no conclusive evidence that it helps. So don't hold on these medications, because these are reserved for very sick patients who need it, who are in the hospital. Let's be reasonable. Remember, most of you will do well. You will recover without even knowing that you had the infection. Don't give the infections to others. Be safe, and hopefully we'll come out of this and we'll look back and smile again.